My name is Katie. I'm a high school special education teacher, an amateur equestrian, a wife, a mom, and as of about 7 weeks ago, a kidney donor. After 7 months of planning and waiting, I was able to donate my left kidney to my mom, who is doing really well so far. 2 days after the surgery and the day after being released from the hospital, I called my transplant nurse and tearfully told her that my pain was surging to a 9 or 10 on the infamous hospital pain scale when I had to get out of bed. She explained that after 48 hours, all the local anesthetic originally injected at the incisions had worn off, and she gave me some tips on how to better manage the early part of the recovery process. Over the next day or two, I had my own revelations about how I could not only manage my pain more effectively, but how I could summarize and relay what I was learning to future organ donors. As a nearly lifelong educator, I've always enjoyed sharing what I've learned with other people, so I'm mentally committed to finding a way to inform others about my experience and imparting some of the wisdom I've gleaned from this life-changing process. It took me a number of weeks to summon the courage to film myself, but here I am. Well, everyone's way of mentally preparing for surgery, along with the logistical preparation for an extended absence from your job and other responsibilities, is going to be unique. I wanted this video to focus on some simple tips to guide you through your packing and preparation prior to surgery. I'm going to include Amazon links to some of these items in the description box below. Number 1. Your donation center will likely remind you to leave valuables at home, so I took off all my jewelry, including my wedding ring, the night before and stored it in a place that I wouldn't forget where it was. Number 2. Well, I didn't end up needing these things. My donor mentor recommended packing lip balm or Vaseline and hard candy to help with dry lips and mouth following surgery. If you're prone to nausea, ginger hard candy could serve a dual purpose, re-engaging your digestive system through swallowing and treating the upset tummy that many people report after surgery. Number 3. In addition to what you wear to the hospital, pack a set of soft, oversized clothes, including pants with an elastic or drawstring waist, seamless underwear, and shoes that are easy to slip on before you head home. For women, I would suggest packing one of those soft bras that you wear around your house, since the traditional underwire is not going to feel welcome after surgery. But wearing no bra at all often feels weird or uncomfortable for a lot of women as well. Keep in mind that from the time that you get checked in for surgery to shortly before you're discharged, you'll be wearing a lovely hospital gown, no undergarments, and those fabulous hospital socks with the grippy bottoms. Number 4. My donor mentor also suggested a long charging cord so that you can charge your phone while still having it nearby to communicate with friends and family after surgery. Number 5. I brought along a soft, oversized throw blanket from home that came in handy for supplementing the hospital sheets and thin blanket. Well, someone suggested I bring a pillow from home as well. I just ended up using the pillows provided by the hospital for under my knees and to place on my stomach to protect my incisions and support my arms. If you bring a blanket or a pillow from home, it could also be used to protect your incisions from your seatbelt on the car ride home. Number 6. I brought a toothbrush, but I'll admit that I did not use it during my one-night stay in the hospital. Somehow, dental hygiene really fell down my list of priorities right after surgery. It certainly wouldn't hurt to bring your toothbrush or whatever you might use to wash your face at night, but don't feel bad if you don't use those things, especially if you only stay for one night, like most of the donors at my hospital do. If you take any prescription medications, the hospital wants to distribute them to you directly, so no need to pack those. Number 7. Another thing that I brought that I didn't need was a water bottle. I normally bring my water bottle everywhere. My current favorite is a 30-ounce Stanley with the flip top, but after surgery, it just took up space on my hospital tray and it made obnoxious sharp clang when it would get knocked over. Nurses and CNAs will bring you all the ice water and juice you want after surgery, so the water bottle just takes up extra space in your bag. Number 8. In all your anxiety, don't forget what I would consider the most important items to bring with you to the hospital: your phone and your wallet containing identification. Number 9. The most unexpectedly helpful thing that I brought to the hospital was a white noise machine. Especially if you're someone who sleeps with white noise or a fan at home, I would recommend bringing something comparable to the hospital. My favorite white noise machines are the ones made by Dome. I find them vastly superior to any of the devices that boast various digital noises. In addition to helping you sleep during the night, they can also help drown out the repetitive noises in your hospital room and random interruptions that may come from the hallway. Finally, number 10. When it comes to preparing yourself physically the night before surgery, You should be receiving instructions on that in your preoperative appointment. If you didn't receive sufficiently detailed instructions, call your nurse coordinator before surgery to make sure you know how they want you to prepare. If your instructions are like mine, they'll ask you to shower and then use this pack of 6 CHG antiseptic wipes, one pack the night before surgery and another on the morning of the surgery. On their own, the wipes weren't particularly bothersome to my skin, but I made one fatal error. I decided to shave my legs during that final shower, knowing I might not bathe again for several days. On freshly shaved skin, the CHG wipes not only burned upon application, but they continued to irritate my legs to the point that I couldn't fall asleep. I chose to rinse my legs with water, as the instructions on the package indicated to do, if skin irritation occurred, but I still had to rub my poor shins down for an hour afterward before I was able to fall asleep. I vowed to try and warn as many unwitting patients as I could about the importance of not shaving before using the CHG wipes. If you have really sensitive skin, I would suggest you do a little spot test with the wipes first before using them as directed anyway. I was told later that many surgical patients do not use wipes, and the myriad of problems associated with developing a rash on the night before surgery would, I imagine, outweigh the benefits of using them. While the directions I was given advised me not to use lotion or any other products on my body, I did put lotion on my face and dried my hair using my normal styling product. I anticipated correctly that I would not have the ability or the desire to do anything to my hair for many days. So if you're someone who has any concern about your appearance in this situation, I would suggest doing your hair, since makeup and clothing options will be limited at the hospital in the days right afterward. So I think that's everything I can think of that I wanted to pass along to potential donors about preparing for surgery. If you have additional questions or suggestions about this process, feel free to add them in the comments below. In my next video, I'll talk about what to expect from your stay in the hospital.